Yes, so people are joining. We can just wait for a minute and then we can start. So by the time, guys, so as we have completed 5 modules of this course, we have completed on how to write the manuscript, what are the components of manuscripts, what are the types of manuscripts, and yesterday I have taken a class on the journal selection and all the factors which we should consider in journal selection. And now we have 3 more modules remaining on case reports, systematic review writing, and the reference management. So today, to discuss the case report, how to write a case report, we have with us Dr. Megha Nataraj. She is a master's in physiotherapy, and she is one of the good researchers, one of the best researchers, I must say, and published multiple papers from Manipal University, from Manipal Academy of Higher Education. Right, and right now she is completing her PhD as well in physiotherapy only, and she is, her interest of area is diabetic foot and sports therapy, sports therapist. So without delaying much, I will hand over the mic to Miss Megha Nataraj. So Megha, over to you, and please introduce yourself. I must be forgetting some more things. Please introduce and go ahead with the class. Thank you very much for accepting our invitation. We're happy to have you here.
Thank you, Dr. Ajit, for yet again giving me this opportunity to join for these modules with Climate Research Solutions. So very good evening to all of you. I'm Dr. Megha, and as Dr. Ajit has already introduced, so I'm not going to take much of your time. We can, I believe, start with the session. So are we waiting for any more delegates, or we can start?
No, Megha, they will be joining in between. They will be joining. There are around 110, but okay. We'll get around 60 to 70 we get in the classes. So we can start anyways, no problem.
Okay, okay. I will just share my screen. Just a minute.
Yes, you can. Yeah.
Yeah, so please confirm if it's...
Yes, ma'am, it is visible.
All right, all right. Just a second. Yeah, so are you all able to see the slide 1? Just which says the title?
Yes, ma'am, it is.
All right, all right. So thank you once again. And yes, very good evening to all of you. It is very nice to see that there are so many of you who have joined on a Sunday evening. And this Sunday evening, I believe, is also very important. It's Friendship Day. So happy Friendship Day to all of you. It's nice to see that you have prioritized learning research on a Sunday evening without, being out and just enjoying your Sunday and your weekend. So kudos to all of you for this good sacrifice that you've made. And over the next course of, let's say, 50-55 minutes, I'll walk you through the concept of a case report. We'll try to understand why a case report is important in the first place, then look at certain guidelines, how we can write one, okay? It's going to be very interactive. So please feel free to stop me at any point in time, okay, if you seek any clarifications or doubts, or if you also have any suggestions that you want to add up, okay? It's going to be a two-way dialect. So let's make the most of the session. And I'm also hoping that most of you have, had your evening chai nashta, okay? Otherwise, the next slide is maybe it's going to make you have some sugar cravings. So anyone from the audience quickly identifies this chocolate? Can I get some volunteers to just unmute and tell me?
Toblerone.
All right. Okay. So I'm sure that, yes, you have all had your tea, coffee. So we are good to go. Can someone tell me what's coming up in this slide now?
Egypt pyramids.
Right. Now, I'm sure all of you are, really wondering, like, what is ma'am up to? She is showing us a piece of Toblerone. We are getting hungry. And then now she's showing us this pyramid from Egypt. I'm showing you this pyramid because this pyramid is going to take us to our next slide, where we talk about the evidences in research and the evidence pyramid in research, okay? So I'm sure you have all looked at this slide at least once in your professional career. And I also believe that most of you are healthcare providers, be it any discipline. So this particular slide, at least once, you must have seen it. So any yes and no's from the audience? Quickly, you can unmute and let me know.
Yes, ma'am.
Right, right. Thank you. Thank you for that prompt response. So as you can see, this particular pyramid is the level of evidence pyramid. The reason why I am showing this pyramid to all of you is because I'm sure you have spotted the light blue colored base of the pyramid where you can see the word case report and case series. And for those of you who are new to this concept of level of evidence and this particular pyramid, you might be wondering why it is important for us to even look at this in the first place. When we talk about patients, when we talk about gathering data and to systematically understand that particular data, as a reader or as a scientist, as a researcher, for us to interpret that particular data, the first thing that is important is to understand कि ये data कितना relevant है. मतलब इसका information, how much of it is good for me to take, good for me to adapt. So when we look at this pyramid, the lowest part of the pyramid comprises of these animal and laboratory studies. So these are, let's say, studies which involve molecules, they involve creating certain pharmaceutic drugs. So all of those, translational type of researches, they happen in this bottom of the pyramid. You're looking at smaller structures, you're looking at very definitive structures. And most of these structures, they can be understood in a very controlled environment. Let's say you have taken, a particular cell sample, there is an animal cell tissue. So you have a very controlled environment where you're looking at this under specific conditions. So that kind of research comes under the category of an animal or a laboratory type of a study. When we go higher up in the pyramid, that is when you have the case report or the case series. Okay, and this part of the pyramid shares its space with narrative reviews, opinion papers, editorials, or even correspondence papers, which come from the experts. Now, you might be wondering that, okay, this case report, case series, matlab kya naya hai? It's just somewhere in the bottom of this pyramid. And why is it even important? So that's what we are going to try to understand. Okay. So about this case series, if you can quickly see, the orange part of the segment is the case control studies. Above that, you have the cohort studies. Much higher in this pyramid, you have the randomized control trials, more of the prospective type of study designs, and the topmost part of the pyramid comprises of the reviews. And even among those reviews, it is the systematic reviews. Along with that, the meta-analysis and the clinical practice guidelines, or let's say the evidence-based guidelines. Now, each of this follows under one level of evidence. So can somebody quickly tell me case report will correspond to which category in the level of evidence? The answer is in your slide. Quickly unmute and tell me.
5.
Perfect. And where would randomized control trials and systematic reviews and clinical practice guidelines fall?
1.
It's 1.
Perfect. Perfect. Great. Good job. So now, when you're going to look at this pyramid, you're naturally wondering, right? Okay, but this is just level 5, and then there are so many levels above it. But why do I even need to, understand a case report? The beauty of a case report lies in the fact that you are narrating a story. You are narrating a story to, let's say, a group of students, a group of medical students, to a group of doctors, to a group of policy makers or researchers, something that is unknown and something that has been, let's say, accidentally found while you were doing something else. So that is usually the scenario where a case report or a case series, usually pops up. Now you might be wondering, okay, case report, so I mean, how many people are supposed to, waste their time on case report? See, the fact remains that even though in this level of pyramid, it comes in the most bottom part of this pyramid, but we cannot disregard the value and the contribution that a case report does to building up scientific evidence. Okay, for us to conduct, let's say, a bigger study like an RCT, you need a bunch of people. Okay, now in this particular class, let's say we have about 47 people. Okay, 47 of us. So all of us are healthy people. So if somebody has to conduct a study on all 47 of us, it's going to be easy, right? Because B47, we are just representing the normal patient, we are just representing a normal population. We are just a part of that bigger population. It's easy to find us. Let's say that we are going to look at a very specific condition or look at a very specific aspect in a particular patient group, but this particular patient or identification is a very rare phenomenon. So such a particular characteristic or a trait, it qualifies to come under a case report. Now, there are many, misconceptions among people as to what exactly we should write in a case report. कि मतलब patient देख लिया तो लिख दिया report, or is it same as any report that we, as doctors, we write it in our clinical practice? No, that's not the thing. Let's understand a few examples. Let's say we are, talking about diabetes, or we are talking about hypertension, or we are discussing thyroid. Now, these are some health conditions that all of us know, right? We have come across at least one person in our known circles, be it family and friends, who usually have all these diagnoses. But sometimes we come across, some little aspects, and we are wondering, okay, what is this? Now let's go back in time to the period when 2020 had just started, and it was January, February when COVID was setting in China. There were a few rumors about some respiratory infections that came up, and I'm sure all of you heard of mucormycosis and various other respiratory diseases. So the fact is that this particular condition, mucormycosis, was something known to the medical community. But what was not known to us is this mucormycosis coming as a symptom or coming as a complication in someone who had a COVID-19. So when you see this combination, it was COVID-19 that was not known to all of us. So such a rare case, okay, so you have one common feature and something uncommon. So that can also qualify to be documented as a case report. Now, some of you may have the question as to, so does a case report mean that it is only going to be a rare patient condition? No, it can be anything that is rare. Okay, it can be, let's say, a diagnosis that is rare. It can be a diagnostic parameter that is rare. Let's say a blood sample or a biomarker, or some particular, let's say some urinary sample or a blood tissue or a biopsy, some such biological sample which is giving us a rare phenomenon can also qualify to come as a case report. So it does not have to mean that it is only with respect to a condition. It can be a diagnostic difference. It can be a treatment approach also. Now, let's say there is one condition, some XYZ condition, jiska common line of treatment is drug A. Okay. Now, suddenly some doctor randomly tried drug B and he saw that it made some changes for that one particular patient. So in this entire scene, the patient ka condition is known to all of us. The existing medication was stopped and just a new medication was added. So what was different here? It was the treatment. It was the intervention that was given that was different. So if you are a doctor, this intervention can be, let's say, a medication. If you are a surgeon, it could be a surgical procedure. If you are a dentist, it can also be some dental procedures that you have changed for this particular case. If you are from rehab or any other sector, or even from pharmaceutic background, it can be any minute change that you did in order to see the difference in this particular patient. Okay, so this all can qualify to come under a case report. Now, the next question will be, who is supposed to write a case report? I mean, can anyone just get up and write a case report? See, the answer is simple. If you come across something that is unique, irrespective of whether you are an undergrad, you are an intern, you are a postgraduate, you are an experienced professor or an experienced professional, if you come across something that is unique and something that is not known to the scientific community, and if that particular, let's say, entity, be it a diagnosis or be it a, let's say, treatment modality, if it has got a scientific merit that requires the attention of the research or the scientific community, then it should definitely be brought into notice by anyone. So remove that thought from your mind that, case reports are written only by experts. No, anyone who identifies something unique, something that contributes to science, to medical research, is definitely welcome to write a case report. Okay. Now, the other aspect is that people also sometimes these questions come up when you're in private practice or when you are in let's say hospital settings. See, if you're going to be a busy clinician, you may be seeing maybe 50, 60, 100 patients in your OPD on a daily basis. So sometimes as a busy doctor, it is slightly difficult for you to look at all these minute details. But let's say you have a team with you, okay? You have a team in your clinic which comprises of, a nursing staff, you have a medical intern with you, you have a social worker, you have a dietitian involved, you have a therapist, you have a physiotherapist or a rehab person involved with you, and all of you together treat a particular patient. Now, in such a clinical scenario, what happens is if something goes unnoticed by the doctor in terms of the patient's findings, there is a possibility that somebody else from that circle is going to identify that unique factor. So this can be, just an MBBS intern student. It can be, the nursing person. It can be some rehab person. So when all of these people come together and when they also discuss the prospects of a particular patient, even that qualifies to get documented as a case report. So I hope this helps you all, break certain myths about case report. So the point one takeaway here is that anyone can do a case report. The case has to be unique, not just in terms of the patient's condition, but also in terms of certain diagnostic aspects, certain, let's say, biochemistry aspects, if there is a difference, certain interventions, if they have been changed, all of these together combined can help us produce better science. Now, what happens in the scientific community is when we identify one particular, person showing this particular unique, finding, it starts, the question starts coming to the doctors and to the research community as to how many more people may have this similar condition. So what happens is one single, research team's case report, it serves as a cascade for more research to happen. So there is again a bigger team that comes into play. People start identifying more patients. Let's say some particular condition was very rare in maybe Kerala, okay? And there was some doctor in Kerala who reported that patient condition. And somebody sitting in maybe Delhi or somebody sitting in Northeast read that paper. And suddenly they also felt, yeah, I also have seen something similar in my patient group. So what happens is it is something that starts as small as a single patient's case report. It builds up to that cascade and to that chain reaction where more people become aware of this, and they also start identifying similar conditions in their patient population. And that is when much bigger studies, like let's say a case control study, a cohort study, or an RCT, are actually practically possible for researchers to conduct. So case report does not stop by just reporting one patient's uniqueness or a unique aspect, but it also serves as a base. It serves as a platform for future research in terms of the higher levels of evidence to also contribute to the building of the scientific information. And many a times, these small findings of a case report, they have the ability to reach at policy level, something that can change guidelines and practices for healthcare policy people and even economists to start acting on this. And let's say as a government, when government officials, when healthcare officers, when they look into this particular, policy briefing or clinical practice guideline, then they start implementing these changes in all of their, state or central government activities to facilitate better patient care for that particular group. Okay. So these are all some of the common, aspects when we talk about a case report. So please, do not undervalue the importance of a case report. And when given a chance, always start looking at every case as a case report, because the beauty of a case report lies in the way you're able to narrate a story. Okay, I will share an example with all of you. Just I think a day before, I was speaking to one of my friends who is also a PhD completed professional from the field of optometry. So they work with the eyes. They are rehab professionals who work on, deficits and disorders of the eye. And he happily told me that, two of the case reports from their institute have got accepted for publication. And it was so stunning for me because when he shared that particular, patient's picture of the eye, it was so beautiful. Just like the fireworks that we see in the sky when Diwali is around or when any festive season is around, they have actually captured such a Diwali shot in the patient's eye when the patient had come for a regular OPD visit. So why I want to share this with all of you is that a case report, as I said, anyone, any healthcare professional is, a very good ideal candidate to write a case report. And the more you start, discussing case report with people across various professional backgrounds, there is so much scope to learn. Okay, now some of these patients we might be treating, some of these patients you might be treating as pharma professionals, you might be looking into their drug charts. So all of these things ultimately affect the patient, and patient is nothing but a very human life, just like all of us. They are not going to discuss their health issues with someone if they don't find it very trustworthy enough to do it. So the art of conducting a case report also lies in your art of seeking information from the patient. So most of it comes off as a story. So in a simple clinical history taking, when you ask the right questions in the right manner, the patient starts telling you a sequence of events. Doctor, ऐसे हुआ, फिर ये हो गया, फिर मैंने ये दवाई खा ली, फिर ऐसे हो गया, फिर वैसे हो गया. So when you are asking them that sequence correctly, you get the clear picture as to what is happening. And when your diagnostic features, they match with that, then that becomes a game changer to start having these reports documented. Now, the next important aspect for us to look at is कि ठीक है, we got a unique case. So how should I write my case report? कि ऐसे ही story लिख दूं तो चल जाएगी क्या as a scientific report? No, absolutely not. Okay, to write any kind of scientific research paper, we have certain guidelines, we have certain reporting formats. The purpose of all these guidelines and reporting formats is that you are supposed to share very relevant information with your reader. Okay, so sometimes when you when you come across a case report, I'm sure in your previous modules, Dr. Ajit must have taken you through the the writing styles. So there are certain word limits that come when you write a case report. So case reports are not very long. Maximum, I would say it's about like 3,000 words in total, comprising of these facts and figures and tables and certain illustrations that you want to put. So it's not a very elaborate paper. As a published format, it is anywhere between 5 pages to 6 pages. And from a word count point of view, it is maximum around 3,000 words. So even this particular case report needs a certain structure. So the first part is you focus on writing a very attractive title. Okay, so I will later share that title of my friend, okay, from their paper. I don't recall it now. So it was something like Diwali short eyes, seen in an XYZ condition. And the only thing that he shared with me was just a snip of that patient's eye. And mind you, that was so beautiful that even I kept wondering that this is such a unique thing to find in a patient. So such uniqueness can come anywhere. Okay. And as healthcare providers, what I feel is that we are so blessed to help people across all age groups. You can see a small baby, you can see an elderly person, you can see somebody who's in the last stages of their life, or those who are receiving palliative care. We have the scope of offering help, offering medical aid and services to people across all these age groups. So how much of uniqueness can exist in this vastness of the population that we have? So that is something you all must, really take it with you, because every person you see is unique. And just because two people have the same condition, there is never a short way that both of them will have the same condition in the same fashion. Okay. Even the medications that you prescribe to people, for some people you give a higher dose, for some people you give a lesser dose, because that is their individual body response to all of these things. Okay. So far, so good. All of you are with me. Any clarifications, any doubts required?
No, ma'am.
No, ma'am.
All right.
Everything
So
is clear.
will go to the next slide. Okay. So now we are going to try to understand what is the standards, okay, for writing a case report. Now, let's say you are in your clinic, you're very busy, and then you came across a very unique patient, And suddenly, you had this spark and you felt that, yeah, this thing is very new. I mean, I didn't know about this. So can I really, document this patient's findings? So in this case, one practical tip that I will give all of you is that the moment, sometimes it just happens in our clinical practice that we see the patient, we look at some diagnostic aspects, we look at their charts and, all this examination reports, and there is some intuitive feeling that tells you that, see, something is very different about this patient, something is very unique about this patient. So such instances, you should really pay attention and, start extracting as much information as you can, because you never know, over a week or two, you can actually convert all this patient information into a beautiful scientific story, which can have the potential to get published. And, the beauty of a case report is that if it is well written and if it is something really unique, the chances of it getting accepted in a very, very reputed journal is very high. And also the time taken for case reports to get published is much faster in comparison to various other types of researches that we usually do. So if you're in your clinics, I want you to all, have your observatory eyes on all your patients to start looking out for these new factors. Okay. So now we look at the standards or the guidelines for reporting these cases. So for this particular session, I'm going to focus on the guidelines which have been given by BMJ. So BMJ, I'm sure you have all heard of it. It is one of the reputed publishers and, a scientific body. They usually give these standards and guidelines to report. So their guideline is a very simple chart and it's not very complicated. There are many other guidelines that are available for case reports, and you are free to explore all these resources. But just to simplify our understanding, I'm focusing only on BMJ. For those of you who are curious to find other resources, you can check equatornetwork.com. Okay, equatornetwork.com. That is one portal where many free resources, many free guidelines for reporting for different study designs are available. Okay, so you can definitely look at that. Now, before you start, writing down the story of this patient, it's always good to have this guideline ready with you. So some of you may prefer a printout, some of you may prefer it to just be as a report in your laptop. So always keep this guideline open and start reading the instructions of this guideline. Okay, so this template will usually have two parts. Okay, one part will be the checklist, one part will be the template. So while you are preparing the manuscript of your case report, it's always good to first look at the template where you come up with all these headings. So we look at these headings in the subsequent slides. So the purpose is that the standard case report checklist and templates, okay, of BMJ, these are freely available to all of us. And before you start writing it, it's always good to just read it. And one more aspect is when you are downloading this template, usually in the last part of this BMJ template, you will also have a particular document for the informed consent. So let's say that today you found this patient with a very unique finding and somehow you feel you should, take his case report. So ऐसे अगर आपको slightest feeling भी आए ना, I would strongly recommend you speak to the patient in the very first instance only. You just tell them that, see, I encountered, these particular things which are very unique in your case. And as a doctor, as a healthcare person, I would like my other community to also know about this particular finding. So can you permit me to document your detailed report, which I can share it as a published report with the other readers so that other patients can also benefit. So that should be your very first instance when you communicate with the patient very effectively, making the patient aware that while he is being examined by you, that is a very good time for them to also seek their clarifications and doubts with you. In that stage, if you win the confidence of the patient and if the patient verbally gives you the consent that, yes, doctor, please, you do whatever you want with my data, I do not have a problem with it. That is the time you should take their written consent also. So this BMJ case report also comes with a separate document, which is for the informed consent. So in your clinics, always keep at least 4-5 printouts with you, so that if you identify something then and there, you give that sheet to the patient where you have explained to them and the patient can officially sign that paper for you. Now you might be wondering, why should you take a patient ka sign even before treating the patient? I'll tell you that in the later part of the slide. So far clear? So what we are doing, we understood the importance of a case report. Now we are thinking of converting that particular patient ka data in an actual case. So we are looking at BMJ ka guidelines, and now we are going to go step by step. Okay. Now, so the first aspect which I told you comes with the patient consent. Okay. So in this case, since we have directly spoken to the patient and patient has told us, yes, doctor, you have my consent, we don't have anything to worry. But there are certain patient groups, okay, let's say old people, okay, who are dependent on a family member, they have a caregiver, or let's say some of them, they have these, memory deficit disorders like Alzheimer's, dementia, and they don't really know, so their cognitive abilities are not that good. Some of them have psychiatric issues, or it can be, small babies, infants and adolescents who do not have the authority on taking their own responsibility. So for a child, adolescent kid or a baby, the person who has to give the consent is either the mother, the father, or the guardian. Okay, so it is also important for us to take consent from these people. So first thing, make sure if your patient is cognitively stable, he understands everything that you're talking to them, and they are reciprocating that communication back to you in an effective manner that yes, we have understood and we have given you our consent. If that is not possible, it's always better to have somebody else with the patient. It can be the relative, the spouse, the guardian, the caretaker, depending on who is providing care to the patient. Now, sometimes, there are some conditions where these patients, they belong to certain, care group centers or homes and all of this. So it becomes very important to involve all these people. And sometimes this reporting or permission, you need even the higher authorities like the doctors or the people in charge. So make sure that you have covered that, the line of responsibility, who the person is going to give you, that has to be very clear with you even before you start thinking of converting that patient's information as a case report. So the first thing is you have obtained the consent. Okay, preferably the written consent. Okay, always having it as a signed document, because verbal consent is very difficult to prove in the later stage. Somebody may tell you, nahi nahi, maine to ye kaha hi nahi tha aapse. So all such things are very possible, especially if you are practicing doctors in rural setups. You never know how much a person understands what you're telling. So making sure that they have the right understanding about their health is a very, very critical aspect. Okay, so that is the first part. Now, in the next important part of your case report is that how many people should be involved in this case report. See, sometimes we read some papers जिसमें title सिर्फ एक line का है, but author, the names of the authors are like a paragraph. And if it is a guideline or some kind of let's say a reporting tool or some new scientific report or policy paper which has come up, the names of people itself cover 2-3 pages, because that many people were required to make it in the first place. But for a case report, you don't need so many people. It's hardly 4 or 5 people. So it can be the treating doctor, it can be the assisting doctor, it can be another healthcare provider or a biochemist who's involved in certain let's say blood parameters and some of these charts. So such people together can form a team. So while you are forming this team of these authors who will qualify to come as authors for this case report, it is very important to understand who is the first author, who will be the core person who does the work, who are the others who will assist the work. So the very ideal way of understanding that is the person who first comes up with the idea, who first takes the effort of doing all the work, okay, and who does about 70 to 80% of the maximum work. That is the person who qualifies as the first author. So usually in an academic setup or in a hospital setup, if there are younger juniors involved, it's usually the student or the undergrad, postgrad, intern who end up becoming the first author, because they do all the hard work that goes into putting all this as a report. And you have senior doctors, you have senior team members who do the work of supervision. They do the work of critically reviewing that particular work. They do the work of editing the document. They do the work of let's say supervising the work and providing the resources. So such people get the subsequent positions as author 2, author 3, author 4, and the corresponding author. So usually the first author is the one who does maximum work, which is almost like 80% of the work, and information about who is a first author is also available in the ICMJE guidelines. For those of you interested, you can go and explore these resources. Then you have someone called as the corresponding author who will take the sole responsibility. Now, let's say if it is a very big hospital, a very big OPD department, naturally that intern or that PG student resident may not have that much authority to take over that particular patient. So the best person to say that I am responsible for supervising all this work should be the head of the department, who will also serve as the author of correspondence. So while your entire report is ready, it will be that chief doctor who will end up, submitting that particular report for that particular journal. Okay. So I hope you understand that we don't need too many authors. We can keep it very minimal, but just identify which author does what part of the work. Okay. So that is one thing. Now, next thing is that we also have to make sure that what we write is going to be a very authentic information, because when you're just going to start writing these documents, see, these days I'm sure all of you are aware of various artificial intelligence tool. Chat GPT is just sitting ready in our laptops. Anything we want, that has become like our next friend. You just put one question and very beautifully it gives you answers in matter of seconds. Okay. So the thing is, if you want to do shortcuts by using these tools and resources and writing your case report, mind you might be in trouble, because editors and journal publishers, they are very smart in identifying all this written information which is written by the machines. And these days they also take one disclosure from the authors that you have not used any AI tools or language tools to write your particular manuscript. So make sure you don't do these shortcuts, and you actually write it as a very authentic, relevant piece of information for your patients and for your readers. See, because end of the day, the purpose of you documenting the scientific report for it to be published, for somebody to read it, is that you want to, the ultimate aim is you want to add to medical science, you want to add to patient care. So with that being your motive, we shouldn't fall trap to these shortcuts. Okay. So there are various tools like Authenticate. All these tools are used by publishers to check for all your documents, whether they are authentic and whether it has been copied, simply copied from here and there. Somebody wrote on diabetes, you found something diabetes plus XYZ, तो तुमने वहां से यहाँ पे कॉपी कर लिया, तो ये नहीं चलेगा. This is not going to be accepted. Okay. Next part is, while you're writing it, the very initial stages only, it is always important to have a discussion with all the doctors, in your team, all the authors in your team, to make sure that everybody is agreed upon getting that particular work published. Because see, sometimes kya hota hai, as a student, you are in that OPD setup under Dr. XYZ, and you saw this unique case in that doctor's OPD. But by the time you wrote your manuscript, you sent it to the journal, now you are out of the institution, you are out of that hospital. So the question remains is that who is the one who is going to take responsibility for that patient? The patient belongs to the hospital of the doctor XYZ. So you have to keep that team involved. Okay. So you cannot add a completely new hospital where the patient is not a part of. Let's say patient Kerala ka hai, or tumne later you move to some part of Gujarat or Rajasthan, and then from there you want to publish this work. You have to publish it from there, giving credit to the institution in Kerala where you identified this patient. So, okay, make sure that you do not go wrong in all these places, because this leads to a disagreement among authors, which can really reflect back very negatively on a publication. And if identified by editors later, there is a scope that they may even retract your journal. During COVID, I'm sure you all must have come across, NEJM removing so many papers on COVID because they were feeling that this data is all, falsified. So these things come into picture. Okay. Next thing is that you also have to make sure that the language that is used in writing should either belong to the to the UK English, the British English, or the so you have to just read the journal guidelines to just make sure that you are following it in that particular style. Otherwise, the journals may tell you that please correct your grammar, please take help from somebody who is good in English to write your paper. Because sometimes what happens, different geographical conditions, different geographical places, because they have various geographical backgrounds, the way people's bodies react to all these conditions is also very different. So let's say I am some doctor sitting in Japan, and Japan has this very unique health problem, जो मैंने एक patient में identify किया. So my native language of writing the scientific report is going to be Japanese, but I cannot expect the readers in the world to read my article in Japanese, right? So I may seek assistance in converting this Japanese document into an English document for the readers to read it. So these are all things that come into play when the language preferred to write the paper is not English. So since in India we don't have that problem, English has become a very fluent language for most people. We don't have to worry about it, but countries especially like China, Japan, then there are some parts in Europe, these countries focus a lot of their data in their native languages. And I'm sure some of you must have also seen, in certain journals, when you see the abstract, the English abstract will be a very small part, and then there'll be a very, different language abstract written. So these countries, they publish their material in two languages. So these are things you should be careful. Okay. Now we will look at the parts of our case report. Okay. So the first part of the case report is our title. Now, why the title of the paper has to be very attractive? What is our human tendency? See, when we are, let's say, reading some, news in our mobile phone, we are going through apps like InShots, or we are actually grabbing a newspaper in hand. Where is that moment in time when we fix our attention to one particular aspect of that newspaper? We look for a catchy title, right? So if the title is very attractive, if the title comprises of some words that we don't know, or if we read something controversial. So these are things that psychologically trigger the human brain. Ki, no, I'll stop and first read this thing. Now, let's say I just put a title, case report of XYZ in India. This title is okay. I'm not saying it's a bad title. There are many titles written this way, but if I change the title in a manner like Diwali shot in the eyes of diabetic retinopathy found in XYZ hospital, are you not triggered to read that particular work? Because what are the catchy words over here? You heard the word Diwali shots, and you are wondering, Diwali shots, is this like Cadbury shots? What is this? So there are so many questions that come to your mind, and that is what makes the reader want to see your title, then quickly scan the abstract of your paper, and from your abstract they are drawn to reading the full text of your articles. Okay, so the title plays a very, very important role. Most of the times we do not include the phrase "a case report" in the title, although there are some journals who insist that you write it. So that completely depends on the journal guideline. Usually it is not written. We keep it very, the title is usually very straightforward with some attractive phrase, something that, we grab the attention of our reader. And one more thing, this particular title doesn't have to be very long. Okay, so it has a certain character limit. So these limits are again already pre-described by the journal guidelines. So you just have to make sure that you are fitting that particular checklist for writing the title. And then you have something called as a summary. Now this summary is very, very similar to the abstract. So आपने title पढ़ लिया, Diwali shots. Okay, now you're very curious, ये क्या है? Let's find out. And then your eyes are drawn to reading that small section of the paragraph, which is a very short paragraph. And most of the time it is just one paragraph which has about 3 to 4 sentences, maximum 5 sentences. And if this particular summary is in some other format, then you may see, certain, let's say, smaller, aspects like a background, you have an objective, a methodology, discussion, conclusion. But usually for a case report, we don't really write it in that manner. It's just one short paragraph, maximum 150 words, maximum 200 words. And this is usually a very unstructured form of an abstract. You're just saying a story very short. That's all. So reader ने title देख लिया, title से interest आ गया, तो तुरंत they have gone to your abstract, that short paragraph. So here, the art of writing will come in you mentioning the very right aspects of your entire word. So let's say you wrote 3000 words, but that 3000 words go, you have to convert into only 150 words. So you have to play it very smart in writing the right sentences with the right information so that the reader gets a gist of what it is that they are going to read in the full text of your paper. So the flavors that you add to your case, especially to this to the summary or the abstract section, that becomes a very crucial point. And in some journals, other than this title and your abstract, they also ask you for something called as, learning points or highlights or, some takeaway points. So you are supposed to give that as some 2-3 bulletin points. A unique case found in India. This case showed XYZ thing. Then, this was the finding. So just 3 lines, you are giving a much shorter overview of your entire patient condition. Okay. Now, after this whole, crisp part of the paper, now we go on to writing the background. So this background is nothing but also the introduction of your paper. See, now when we are looking at the structure of the paper, पहले हमने title डाल दिया, फिर हमने उसकी abstract लिख दी. Now the next part of the paper, we start thinking about how is it that we are going to structure this particular paper. So when you talk about the background or the introduction section, you usually start with certain facts and figures. So let's say India is, diabetic capital of the world. We have so many million people with diabetes, XYZ complications. Then this part of India has this much problem. This part of North India has, this much prevalence. So the facts and figures usually form the very first, aspect of this background section. Then from there, once you've identified and highlighted the prevalent relevance of this health problem, then you take the reader to the next stage as to, okay, ये problem है, तो इस problem के अभी तक existing solutions क्या है और अभी तक क्या किया है, and what has not been done, and what is it new that you are going to add as a piece of information to this reader. So this introduction background section will have 3 short paragraphs, anywhere between, let's say, 600 to 800 words. You don't usually cross more, because you want to keep the remaining word count in the later part of the manuscript, where you are going to actually talk about the patient's findings. So don't waste too much words in this section. Problem statement, what is known, what is unknown, and what is it that you want to speak in this particular case report. That has to be a very clear message. Okay. Next, we go to talking about the case presentation. Now, see, these titles, in a case report, that can slightly vary again based on journal to journal. So BMJ usually starts with the background, then they go with the case presentation. So case presentation, some of the points to see in the flow will be, what was the patient's story? And while you are narrating the story, you have to be very sensitive enough to maintain the patient's confidentiality. Okay. So that is why it becomes important, what I mentioned earlier, to seek the consent in a very starting stage. Then you speak about how this patient, presented to you in the clinic. So the patient came on day 1. You can mention the date when they visited your OPD. So on that day, what is it that the patient reported? Then listening to what the patient reported, what were the things that you went for an examination? So did it involve, only a biochemistry examination? Or was there any urinary analysis? Did you extract any blood tissue? Did you go for any other procedures like a scopy or, a biopsy? What exactly did you do? While you did those procedures, what did you identify? What you identified, is it already existing or is that a very new thing? So all those little pieces, it's like fitting the pieces of a puzzle. You have to fit the right pieces in it, because sometimes what happens, when we find a very unique case, we are just very excited कि हाँ नया patient मिल गया, let's start documenting this case, मुझे तो case report करना है, I will publish it. So these are all the thoughts that actually come in our mind as researchers. Okay, I've also been in this position, so that's why I'm telling you, instead of being over enthusiastic about the case, it's important that we, in a very methodological fashion, we identify what is it that we want to tell it to our readers. So once you put your case in this very beautiful story format, it's very easy for the reader. Sometimes what happens when you're talking about certain conditions or certain procedures, they may not be very commonly known to people. So you may have to write a short paragraph on what is that. Now let's say I say कि मैंने kidney की biopsy की है. तो किडनी बायोप्सी वी ऑल अंडरस्टैंड कि हाँ किडनी से छोटी सी टिश्यू निकाल दी, उसको चेक किया एंड उसके फाइंडिंग्स डाले. सो दैट वाज नॉट समथिंग unknown to all of us, but there are certain medical procedures that even we as healthcare professionals have never heard of. So if you think even if the diagnostic method is a very unique one, it is also important to write a short paragraph on that particular method, stating whether it is a gold standard method for this particular condition, or was it used in some other condition and you are testing that in this condition. So all those things you have to mix and match. ठीक है, one simple example to help you understand. See, in diabetic patients, we usually metformin is definitely one of the drugs that you give, but there are other non-communicable diseases where metformin is also given. So here metformin is not the issue, but it is about who it is who's going to get that drug. So these things, so if it is known, do not waste time in writing about it. But if it is something that you feel the reader may not know, it's always good to mention that, and also add the abbreviations or anything. So abbreviation is nothing but now instead of every time writing coronavirus 2019, we just make it as COVID-19. So it's better that you use these short forms very limited manner in your manuscript. And also it is better to keep it in the very start of the paper so that throughout the paper you're not re-repeating every time. So usually for hypertension, we use the word HTN in caps lock. For diabetes, we use the very common abbreviation of capital D and capital M. So these things we know. So you don't have to waste time in again mentioning these abbreviations. So try to avoid and keep it very, very minimal. But if you still think you have to use it, then you should mention it in the very start of your manuscript. Okay. Then we go on to discussing the investigation. So this investigation chart, no, according to me, it is good if you write it like a flow chart, like some schematic thing. Okay? When the patient came, step 1, I did this. Then from that, I did this next thing. Then I did the third thing. Then I did the fourth thing. So what happens when you provide that visual, feel to the reader, as they read your paragraph, it's easy for them to go back to that figure and also try to see okay, it's easy for them to imagine the sequence of events that must have happened. Let's say I'm just telling you a story this patient came and he was coughing, the cough was productive. See, these are ways in which I am telling you the story. But if I have written this information in a paragraph and I've also given you like a nice flow chart for you to look at it, it becomes very easy for you to see the sequence. So that is a very good way to represent the findings. Then it's also important to draw certain management outlines. So you have enlisted your investigations. Now each investigation requires a certain management. Simple thing, patient came with cough, so you cannot just give him some random medicine and send him. You have to first assess the cough. You have to see if the cough is affecting something else in his in his body. So you may have to do, let's say, a pulmonary function test. You may have to see if the condition is restrictive type of cough, if it is a obstructive pattern. So there are so many things. So as you are saying that this is the investigation I'm doing, for this investigation, this is the item that I have looked at. So now let's say if it is diabetes, so condition diabetes, but what is it that in diabetes you're looking at? So it is the glycemic parameter. So fasting, postprandial, your HbA1c, or your glycemic index, or let's say it is a glucose monitoring. So that is the entity that you want to look at. Now this entity, you have looked at it and this entity ka value is already there with you. Now you have to also see this value falls under what chart. So is it a mild problem? Is it a moderate problem? Is it a severe problem? Because the management that you will chart out for your patient will again depend on this category of mild, moderate, severe. So giving it as a beautiful algorithm will be easy for the reader to understand. And many a times having it as a flow chart algorithm or any schematic figure, it really I would say that's a trick to get your case report published. So you have it all in facts and figures, and it really supports the work that you have done. So if you're planning to write one, please keep this in mind. Next, we also have to rule out for these differential diagnosis. Okay, so differential diagnosis may usually, see, you don't have to write paragraphs and paragraphs ke patient ko ye bhi ho sakta hai, wo bhi ho sakta hai. No, what did the patient come with? For that thing, what did you check? While you check that, what did you find? What are those findings indicative of? Are those indications identical to any other existing condition which can show a similar pattern? That should be your differential diagnosis. Usually what happens in this differential diagnosis that we get carried away. We'll write this also, we'll write that also, ye bhi likh diya, wo bhi likh diya. Then what happens is the story, the meaning that we add to our case report, that gets diluted. So you have to be very careful about chalking the exact information that you want your reader to read. Now, the next aspect is, okay, you did all the diagnosis, then what is it that you're treating your patient with? So if you all remember in the start, what I told you, the case report does not depend on only the patient coming with a unique finding. It can also be a treatment that was very uniquely developed. Now, let's say there was some laboratory in Maharashtra or maybe anywhere. They came up with some very unique combination of medication and they just wanted to try it on some patient. So, यहाँ पे what is new? It is the modality of treatment. It is the intervention that is new. So, this intervention can be pharmacological, it can be non-pharmacological, it can be a surgical, treatment, it can be therapy, it can be supportive care, it can be anything. So, it's important for us to mention what is it that was given, why this particular treatment was, chosen to be given, and what are the specifications. So when you talk about, I have given this treatment, now how is it that we all take our medications? When you go to the doctor, doctor tells you, right, कि हाँ ये दवाई सुबह एक बार खानी है, ये दवाई रात को एक बार खानी है. Then some medications they will tell you only after lunch. So your antacid. So there are so many medications that if the patient takes, it's also important to help the reader understand the sequence of all these treatments. So that also becomes very important. So this helps the reader understand the dose that was delivered. Now, dose can be anything, not just in terms of the medications from pharma point of view. It can be any dose. Let's say you have given the patient received some kind of a laser treatment for his eye. He had a problem with the eye, so he went for a laser treatment. Now, so laser कितने घंटों के लिए दिया? Did they give it for a few minutes? Did they give it for a few hours? How did they give it? Who gave it? What was the wavelength of the light that was given? Then how did the patient sit? Was the patient, sedated while this was given? So these are all steps that you have to narrate. It's just something as simple as, you want to make your tea, and it's about, putting the right ingredients at the right time. If you're going to mix the wrong ingredients, then for sure the tea will not turn out to be good. So in a similar fashion, you have to also indicate the list of therapies that are being given, what time it was given, how it was given, who gave it, after you gave it, immediately after you gave it, how did the patient respond, then how long did you wait till you gave the second dose or, the second day of the therapy, how many days did the patient take this therapy, and when did you decide to stop the therapy. So there is always a start point and there is always an end point, and all of this needs to be addressed in absolute detail while you mention the treatment modality for your case report. Okay. This becomes all the more important in a case report because you're dealing with only one patient. So the natural understanding for any reader reading your paper is that, okay, see, why did they miss out on this paper? Sometimes what happens, you are reading any particular scientific paper and you're only wondering, okay, how did they give this? But they have not explained, this particular thing, ye drug kisne diya, ye kabhi diya. I'm sure some of you must have read these randomized control trials where it is so difficult to understand कि कब क्या treatment दिया, वो washout period क्या था. So if these things become important in the higher levels of evidence, they are also equally important in the lower part of the pyramid, because here you are only dealing with one patient. So the reader or the editor or the reviewer, they also want to get all this detail, all this minute information, because as they read your paper, they are also able to understand the sequence of events. So if there was a methodological flaw, that can get caught up. If you overgave a medication, that can also be brought to the notice of the editor or the reviewer or the reader for that matter. So these things have to be taken care of. Then the ultimate tip is that you always, talk about the follow-up data whenever possible, as I mentioned to you, because see, when you are giving a patient any intervention, it's not important कि हमने ये दिया. Okay, now let's say you had the cough and the doctor gave you a cough syrup. He told you, do this humidification, do nebulization, सब कुछ कर लो. But then if you're not telling the patient कि ये कितने दिन में ठीक होगा या आपको next follow-up के लिए कभी आना है, that becomes a lost information, right? The patient may feel better in 2 days and he will say, हाँ मैं तो ठीक हो गया हूँ, why should I go to the doctor now? But If the patient already knows, okay, no, my symptoms may come down, my cough may come down, but there is a possibility that my entire infection has still not gone. So I do have to go for a follow-up. So giving this clear picture is very, very important while we are addressing the outcome of the patient. Okay. And always try to keep the follow-up period very defined, because when you keep it very vague, ke day one mein aise kiya, discharge ho gaya, fir 1 month, 3 months, what happens is you lose a sequence. So when you have something in a more structured, defined time period, it's very easy for us also to understand whether have you followed the normal protocols of delivering that patient procedure, or did you kind of make it in a very individualized manner. So these things are again very important. And another very, very important outcome, especially when it comes to this case reports, is that many of these cases, they are very rare. So sometimes when they get a certain treatment, there is a possibility that after the treatment something can go wrong with the patient. See, there is never a guarantee. So the patient also needs to know, the patient party also needs to know that, see, we are trying our best to save the patient, but there is a possibility that something may be a little unfortunate to deal with. What if the patient dies? What if there is a mortality? So you have to take into account all of these things. And sometimes it's also such a thing that, see, if you're doing specific drug trials or any specific intervention which is kind of a funded intervention, then there is some amount of compensation that the patient or the patient party gets if something goes wrong with them, or if certain side effects or adverse reactions happen. So all of these have to be taken into account while you're planning your case report in terms of writing it. Then the ultimate part of the case report is the learning points or the takeaway messages. So sometimes you have to write this in the last part of your manuscript, or sometimes they also ask you to write this just near your summary section. So it again depends on the journal. So here you don't have to re-repeat anything. Try to give the information in very short sentences, that this is the condition first time found in Karnataka, and this is the best treatment that was found. So something which is very crisp. It's like a headline information that you end up giving. Okay. So that is usually the takeaway messages. Then next, that is the last part of your case report, is you are discussing this case. Now, all this while you narrated that you gave a background of the problem, you help the reader understand what is it that you're trying to do with this patient. You told the reader a story of your patient, what you investigated, what you treated them with, and now you have to somewhere conclude it. Na? You have to tell them कि हाँ ये ऐसे ठीक था या ठीक नहीं था. You have to give them some end to the story. So some end has to come. So that end part of the story comes to your discussion section. So discussion, again, it should be a very brief of whatever has happened in this particular case or condition or treatment. And you can discuss if something similar was done in some other case report or in some other kind of study design, something that you can add on to your existing work. So let's say metformin is the usual medication that is given or considered gold standard. For this patient, you gave metformin, but in combinations with this. So you have to write the supportive information of all of this in this particular discussion section. So you talk about what were the similarities with something that's existing. You talk about some contradictions with respect to the research which was in favor or not in favor of this particular work that you have done. So all of this information has to be again, briefly chalked out into the discussion section. And you also have to clearly highlight why your paper makes an exception to get, published. And you also have to state if you have followed the recommended guidelines while you, write this particular case report. Then the last part of the case report is usually the references. And I'm sure you all know there are different styles of references. One of the commonest, simplest style of referencing is Vancouver. Okay. And you can go with any other type. There is Chicago, there is Harvard, there is APA, AMA, NLM. There are a lot of styles available. And these styles of writing again depend upon the journal and the journal's requirements. And in order to manage these references while you're writing this particular case report, you can make use of various reference managing tools. I'm sure your subsequent modules, Dr. Ajit will take you through these topics. Okay. Now, once you have covered all this aspect, bits and pieces of your case report, it also becomes important to add some figures. Okay, you have to add some procedural photographs. So let's say it was some ECG, or it was a blood report, something which is good for the reader as an information. It can be a chest X-ray, it can be a CT, it can be an MRI, it can be a snapshot of the eye of the patient having that phenomenon. So these type of informations can also be added as a supporting document to your case report. So usually it is a figure, maximum one figure, and maximum one table is permitted for a vast majority of case reports across many journals. Some of them permit it to be like two figures and one table. So again, it depends on the journal guidelines. Some of them also ask you to, add something called as a video caption. So you can actually, capture a procedure and then put that as a supplementary file in your paper. So these are all, again, various combinations that exist with different journals and publishing houses. So once you read their guideline, you will be able to, construct your papers in the format that it is required. So with this, I've taken you through the journey of, what a case report is, why is it important, and why do we write it, and how is it that we are supposed to write it with referring to the BMJ guidelines. So I'm done with the lecture from my side. If there are any doubts, any suggestions, we are open to take the questions.
Hi.
Yeah. Any questions from anyone?
Hi, everyone. So any questions from anyone?
I think there is a message in chat box, ma'am.
Just a second. I'll just look at it. What are global health case reports? See, global health case reports, these are, see, one thing is, again, this is a unique patient information that is specific to a certain, geographical area. And global health case reports, if I'm not wrong, is also the name of one of the journals. So I'm not sure if it is the journal that you're asking me or.
No, Megha, I would like to take this case.
Yes.
I would like to take this question. So, guys, as I have discussed in my last class also, so there is a very different, type of case reports, right? There are different types of case report. So, global health case report is a type of case report which is only being published by the British Medical Journal. Okay, and this is the thing I think I have showed you, right? In my last class, I have showed you that I only have published one case report under the global health scenario in the BMJ, British Medical Journal, right? So what exactly is global health? See, as we always choose that case report must be unique, must be, rare, or must be something which is, out of the normal things, right? It is giving something new to the society. It is giving something, new lessons to the people, community, to the scientific community, to the people, right? But global health means we can take any normal case also, right? Global health means there are certain, things like, we can take some, rising pandemics or endemics, or, the issues which are related to the society directly. Okay, like sanitary issues, or maybe the people who are living in the slum, what kind of congenital problems they get in their children, right? So that kind of things, if we are just taking a case as a base, okay, if we are taking a case as a base and we are writing the entire thing about that condition, about the government role, national government role, and the international organizations role, like UNICEF, like there are multiple, okay, like WHO is there, CDC is there, UNICEF is there, and how we can prevent those conditions, what are the other parameters what we have to think of. So this is just one section in British Medical Journal where they give some questions specifically to identify, okay, and to mention about those questions and to explain those questions in the case report. So first what you can do is you can just get one case related to that topic. As you can see my title here, an infant with congenital rubella syndrome. See, rubella syndrome is not at all something which is not common. Okay, you will find out everywhere rubella syndrome, but congenitally, when some pregnant women get the congenital the rubella infection, that can lead to multiple dysfunctions in the children, okay, in the baby, in the infant, okay, in the fetus. So those congenital problems could be either cardiac, could be either related to the hearing, related to the nervous system, or multiple other systemic effects, right? So those things can be addressed in the case, like through one case, how it was, how did you find that, what were the investigations you did, what was the treatment pattern you did. So first you have to mention about the case entirely, and then they give the problems, global problems, okay, global list of the problems, if I say. Okay, so BMJ has the list of problems what you must explain in the case report, or through the case report, I'll say. Okay, if you can see, like, see, prevalence and diagnosis of congenital rubella syndrome in general population, morbidity and mortality due to congenital rubella infection, economic burden of the disease. So you can replace this rubella infection by any other disease also, okay, any other social issue also, any other global issue also, right? Maybe something about corona or long corona, or corona induced what we say new onset of diabetes. You can write the global health report on that also, right? Just take one case which is induced by corona, and then you can write, you can mention about the problem, you can mention about the problem and their prevalence, diagnosis, about their morbidity, mortality, and the economic burden of the problem, and then what are the roles of national and international governments and organizations which are working on these fields, and how you can prevent that. Okay, so that is nothing but a section of the case reports only British Medical Journal of Case Reports publish. Okay, so that is how you can write the global case reports. Okay, that is the global case report, and you can see I have addressed one by one all the things, and this is kind of discussion, and it takes a lot of content. Okay, so this is kind of review of literature, and this is kind of where you are showing the policies, role of governments in prevention and vaccination. You are talking about the policies, like how government of India, or how government of from wherever you are writing, or international governments or international federations are taking part in these. Okay, I hope the question is clear now. Suhana?
Yes, sir.
Okay, thank you. Can someone write a review article on case report? No, review article on case report you cannot write, but you can include some cases. You can include some cases when you are writing the case report and you are getting literally good content from a case, then you can quote it somewhere. You can cite the case somewhere in the review paper, but if you want to write the entire review paper on the cases, that's not possible. But one more thing, let me tell you, nowadays, there is a trend of writing systematic reviews of case reports.
Yes, that
okay
is possible.
So you can write systematic review on the case reports. That is only for the very rare cases, okay, very rare diseases, very rare treatment patterns, right? So in such cases, when if I say, when you write the systematic reviews, you write the systematic reviews on the clinical trials, on the multidisciplinary clinical trials, on the randomized controlled clinical trials, community clinical trials, and all. But if in some diseases, in some conditions where clinical trials are not possible or not been done yet, in those cases, either you can take some other kind of studies like cohort studies, or some case control studies or cross-sectional studies, right? But if those studies are also not available, you can write the systematic review of case reports, okay, on the specific disease. That can be easily done. I hope you like the class, guys.
Hello. Hello.
Yes, please, nice. Please tell.
Yeah, sir, sir and ma'am, I would like to ask, in the BMJ journal, case report journal, there's this column which talks about ethics committees permission. So usually when we do a case report, we do not go for ethics first?
You
Like how
don't
we
need the ethics committee approval for cases, but you need is consent, patient's consent, or the legal guardian's consent. If you are publishing in BMJ, you must have the consent form, the hard copy, the print copy of the consent form, and that you have to scan and submit. There is no need to get the ethics approval for any kind of case report or case series.
But actually it is mentioned in the BMJ case journal, case reports that the ethics committee's approval is needed.
No,
That is why I
where
raised
it has
this.
written. No. In BMG, I'm very sure because I have published multiple cases. I think not less than 3 or 4 cases. So I'm very sure there is no need of ethics approval. And even I published one case in last year also in the British Medical Journal. So I'm very sure there is no need of case, ethics committee approval. You might be seeing some other article. There is a journal, BMJ case reports. Okay,
Yes,
you
sir,
go to
yes.
that and there is no need of ethics approval. I'm very sure, 100%. I'm damn sure. You just need the patient's consent.
Okay. Okay, thank you.
Thank you.
Thank you.
Megha, I think there is one question for you. Can someone who is doing a pharmaceutical research can write a case report? Yeah, see, this
Yes,
question also I'll I would like to take because
yes, definitely.
yeah, that's my field. So if you are from the pharmacy practice and associated, if you have done the PharmD and you are associated with the hospital, okay, if you are seeing the patients, or you're going to the ward rounds, if you are associated with any kind of patients, and you are working under the hospital committee, or maybe the clinicians or the doctors, then with that permissions definitely you can write. But if you are not at all attached with the hospital, and you are not at all seeing the patients, and you are not looking after the patient's record also, then it might be difficult for all of you.
Absolutely. So I think there's one more question. Recently, in hospital, our team has gone through a case of cyst excision, but the cyst size was bigger than the normal. Can I take this case for a case study? Yes, I think you can. See, I'm not sure of the condition that you're referring to over here. I would suggest that you can look into literature. If anything is, existing already, then, you need not repeat it. But if something is, you still find it unique, then yeah, you can give it a shot by trying to get it as a case report.
Yes,
Would
definitely.
you like to add, sir, anything?
No, they can, if they are finding that something unique and which is not
Exactly.
reported. So two things you have to always keep in consideration. One is uniqueness and one is unreported.
Exactly.
Okay, ma'am. Thank you.
Well,
Is a follow-up of patients required for the case report? It is best to include.
it's best, because you get a clear picture of the patient from start to end, and it tells a lot about all the sequence of things that happen, because in between a day 1 of the treatment, a day 5th of the treatment, if something went wrong over there, then how
Absolutely.
did you handle that crisis of the patient? It can be an adverse reaction, it can be some other complication. So mentioning that would add to the the credibility of your people. So if given a chance, you should definitely do the follow-up.
Yeah.
There is Is it okay if we have just records and doctor, doctor, not the patient in hospital? Do you mean just patient information is there, but nobody has
Yeah, that
assessed
means,
the
I think, Megha,
patient?
that means that if you can write the case report retrospectively, definitely.
You can do that. But yes, you will have to reach out to the patient later when the consent is required. So
Yeah,
you have
absolutely.
to hope that they end up coming to the hospital for their follow-ups. Otherwise, yes, getting their consent will be an issue. It's best that you can, just keep a few, consent copies printed with you. At least 3, 4 should serve the purpose, because if at all you come across something, then and there, you have the paper, you explain, and you have their signatures on it, and then you are good to go with the rest of the investigations.
Yes. See, consent form is absolutely important. You can take the consent form later also, no
Yeah,
problem.
that you can do it.
Yeah. It's needed at the time of submission. You should not
Absolutely.
publish any information about any patient without the consent. Okay, when you are publishing a case report especially. So consent form you can take even before submission the paper. You can write the paper, complete the paper, but it will be waste if the patient says I'm not giving the consent and I'm not comfortable to get my information published. So always take the consent form initially and then go ahead. But there is no harm in taking the consent form at any point of time. Not after publication, okay? Before publication only.
Yeah, after publication, then not really.
Then you will be seeing the bars, behind the bars, for sure. If someone complains or the patient says this is my information and you get caught, then you are definitely, going behind the bars.
Because these days patients are also, they are very, very smart.
Very,
So
very
you
much, very
cannot,
much.
Google is their first go-to doctor.
Yes.
Now Chat GPT has become their next doctor. So you have to be really careful about many things. I'm sure you people must have read one latest news. I don't remember the country, but there was an old man who asked for a 3-month weight loss program and all from Chat GPT, and it beautifully gave him a very customized, program for 3 months, and he ended up losing some 11 or 13 kilos.
Yes.
So
Yes.
that is the level patients are using Chat GPT and all these AI tools. So
Yes.
please be careful and have effective communication. That is the key while you want to, for case report, especially for case report.
Yeah.
And make sure you, take into account the sensitive aspects of the patient, and you give them the assurity that this is only for science and their, data is or their information is not at stake. So
see, anyways, when you are
You have to
writing
do
the
that.
case, you have to keep everything anonymous.
absolutely.
Okay. Still, you need the consent form.
Yes.
Okay, consent form format available in BMJ, absolutely. You can get
It
all the
is.
formats there. BMJ is very clear in that. Absolutely, you will get the consent format, everything. You just have to print out. You just have to write your title, patient's name and all, and your name, and you can get the signatures at all. Just have to write some details and you can get the consent. So I hope you like the class, guys. What say? I
Yes, sir.
loved it. I loved it throughout.
Thank you. Thank you, everyone.
That's why I was telling, you must come to the class every day. I'm not the expert of everything. I can teach you some things, but not everything. Okay. See how nicely ma'am has taught. Okay. So thank you, Megha. Thank you very much for taking this class. And, it will be definitely beneficial to all of our audience and all of our participants here. So thank you, everyone, guys. Take care and good night.
Yes,
See you
thank
guys.
you,
See you.
everyone, and have a good weekend.
Yes.
Bye.
Thank you. Weekend is over now. This Monday
Yeah,
blues are
weekend is
starting.
over, so gear up for the week.
Monday blues are going to start.
All
Okay.
right, all right. Have
No
a good
worries, guys.
day.
Take care. Chalo. See you
Yes.
guys. Take care. Okay. Thank you,
Bye.
Megha. Bye-bye. Take care.
Yeah, bye, bye.